Good day, everyone. Not sure where you're joining from. You're probably joining from all different parts of the world, and I'll let Emily, who's going to actually MC this event, do a formal land acknowledgement. And I'm Kishore Mulpuri. I'm one of the orthopedic surgeons that works at BC Children's Hospital. It's an incredibly special day as we celebrate hip health of children and families and anyone that's advocating for hip health or dealing with issues of trying to improve hip health. And this is our day, and this is for the children and families we care for. And what a special day today to have legends like one of my mentors, Dr. Kerr Graham, and Dr. Graf, who is on the screen. I have to pinch myself a couple of times to see. I've never met this man, but heard so much and follow a lot of what he does. And incredible amount of the work he's done is what helps us with treating children with hip dysplasia. And Caden and the other hip legends that we are going to recognize today. So with that, I will pass that on to Emily. Emily Schaefer is our PhD scientist that works with us. A lot of the work that our team here in BC Children's and UBC does with the concept of local to global, and the credit really goes to the entire team, but the team is really led by Emily. So Emily, with that, over to you.
Thank you, Kishore. And hello, everyone. So on behalf of the Hip Hop Network, welcome to our global online celebration of the 3rd annual Hip Health Day. As Kishore said, I'm Emily Schaefer. I'm a co-founder of the Hip Hop Network along with Kishore, and I am the Director of Orthopedic Research at BC Children's Hospital and a Research Associate at the University of British Columbia in Vancouver, BC. So as we begin, I want to acknowledge that our work at BC Children's Hospital and at UBC takes place on the unceded, traditional, and ancestral territories of the Musqueam, Squamish, and Tsleil-Waututh nations. I know there are many of you joining us from across the globe. I would like to extend this acknowledgement, gratitude, and respect to all the communities from which you may be joining us today. So about the Hip Hop Network, we launched Hip Health Day in 2021 with the aims to increase global awareness of hip health and to celebrate the many significant contributions made toward hip health research, clinical efforts, and advocacy all around the globe. We encourage groups and individuals to celebrate Hip Health Day in various ways in the shared spirit of improving hip health around the world. So we're excited to celebrate the 3rd annual Hip Health Day with you. We're fortunate and grateful to have many of the world's leading hip health organizations and advocates here to share updates on their efforts to improve hip health for children globally. We're honored to welcome 10 organizations and advocacy groups, which will be followed by presentations honoring 5 hip legends who have made outstanding contributions to improving child hip health. We also welcome guests who registered from over 25 different countries. The incredible engagement at this event highlights the truly global impact of your efforts. So I'll now introduce our first set of speakers from our organizations and advocacy groups. But first, we have a message from 2021 hip legend Natalie Trice from the advocacy group DDH UK. She was not able to join us today, but wanted to pass on her regard to the hip world. Her son, Lucas, a DDH warrior, is now playing football, tennis, and rugby. And together they are still flying the flag for hippies around the world. So thank you, Natalie, for your message. And next, it's a pleasure to introduce Dr. Patricia Moreno from the University of Sao Paulo Medical School to give an update on her institution's work in Brazil. Take it away, Patricia.
Hi, hello everyone. Should I present the slides or just speak? You give me. Can you hear me?
Yes, we can hear you.
Oh.
Yeah. If you go back a slide, there we go.
Okay. Well, I'm very honored with the invitation to participate in this great event with such wonderful people. So firstly, I would like to thank you for the opportunity. I'm happy to join you in this important mission to take care of children, more specifically today, children's hip health. I am a pediatric orthopedic surgeon working at the same place I completed my medical school education and residency at Hospital das Clínicas at the University of São Paulo, Brazil. And our city of São Paulo has over 12 million people, and the metropolitan area of São Paulo has over 20 million people. Our hospital is the largest hospital complex in Latin America and the largest public hospital in Brazil. And my colleagues and I from the Pediatric Orthopaedics group and the Neuroorthopaedics group work hard to improve kids' hip health. And our Pediatric Orthopaedics group has been a part of IPSG, the International Perthes Study Group, that conducts a multicentric study about Perthes disease since 2012, led by Dr. Harry Kim from Dallas. And we're also happy to start collaboration with GHDR, the Registry for Developmental Dysplasia of the Hip, which run by the team from HIPpy Lab, under the leadership of Kishore Mulpuri and Emily Schaeffer. And also we have the Integrated Center of Neuroorthopaedics, and we see neurological and syndromic patients, especially the cerebral palsy. We have a very committed interdisciplinary team, and we hope to give better care to patients and avoid hip problems. And we're trying to set the basis for a hip surveillance program. So I just wanted to thank you. And I want to say that I'm also very proud to be a part of the Hip Hope Network. And so count on me. Thank you very much.
Great. Thank you so much, Patricia. And next, we will hear from Patricia again shortly, but we have two Hip Hope Network pillar leads, Dr. Alarica Regis and Dr. Patricia Moreno, to discuss some of the work being done to develop region-specific care pathways for DDH and CP. So we'll begin with Al. Take it away, Al.
Sure, thanks, Emily. Do you have my slides? Oh, there we are. Thank you so much. My name is Alarica Regis. I'm a pediatric orthopedic surgeon from Mumbai, India, and the president of the Pediatric Orthopedic Society of India. I can't begin to say how much pleasure it is to be a part of this wonderful group, to be here on International Hip Health Day and to share with you some of the work that we have done in India, thanks to the liaison we've had with the Hip Hope Network and I'm a HIPpy Foundation, led by Kishore Mulpuri and Emily Schaeffer and the wonderful team at UBC Vancouver. Next slide, please. Really, I don't need to belabor this point. We have the unfortunate statistic of being the most populous country in the world. And as we can see, there's a very high incidence of DDH and cerebral palsy hip displacement. Many children coming to us pretty late in advanced stages. And we all know the problems with our healthcare system that we have in India, leading to a very large variability in the equity and quality of healthcare services across our country. Next slide. So a couple of years back, we realized that we don't have any screening guidelines yet for DDH or for CP hip displacement. And we decided, therefore, to liaise with 12 different national organizations, which represent about 125,000 healthcare professionals in India, to set up guidelines for DDH screening and screening of displacement and cerebral palsy. And I'm very grateful to the funding provided by IHDI, by I Am a HIPpy, and by the BC Children's Hospital to take this forward. Next slide. So after a year's work, we managed to develop guidelines for both for developmental hip dysplasia and for CP hip surveillance, which we then subsequently published in the Indian Journal of Pediatrics. Next slide. We're now into the final phase, which is, to my mind, the most important one. And we began this with our mid-year meeting, which we held last year, where we brought together representatives from all these 12 different organizations to debate what is the best way to move forward. We decided that we need to implement various knowledge translation tools to disseminate these guidelines so that they are actually adopted by the doctors and paramedical professionals in our country using various online resources, social media, various conferences and webinars. We're also thinking of translating these guidelines into regional languages because India, as you know, is a large country with almost 16 national state languages. We also plan to lobby the government now to adopt this care pathway and guidelines so that there's a wide dissemination, not only among the private, but also the public healthcare sector. And an important and very ambitious project that we are planning to do is to actually develop a database of referral centers in each state, district, and possibly even a city where reliable ultrasound or X-rays are available and where treatment for hip displacement, either in DDH or in cerebral palsy, can be provided by the orthopedic experts. Next slide. So this is our meeting which we had last year, where we got together, had small group discussions, and really decided to brainstorm to find various ways to spread these guidelines among various professionals in our country. And I really must thank once again Kishore, Emily, the Hip Hope Network, and I'm a Hippie for all the support they've provided us over the last few years in developing and disseminating these guidelines. Thank you very much.
Great, thank you, Al. And then we'll have Patricia give up. So based off of this fantastic work that was done in India, we are taking this and applying this sort of model to other countries and other regions. And Patricia is going to speak on some of the early work done in Brazil.
Yeah, thank you. Thanks, Emily and all. And I'm glad to count on your expertise and partnership to help us develop a care pathway for the DH in Brazil. And of course, this will be carried forward with the consent and support of the Brazilian Pediatric Orthopedic Society. So in order to have, to do what we're working to do, we're now working on a scoping review to map Brazilian literature DDH and find what has been said about screening, diagnosis, treatment, and outcome of this hip condition in our country, and possibly map epidemiological data and regional differences. And also another way to understand knowledge and practice by pediatric orthopedic surgeons, pediatricians, and neonatologists by applying an online survey in the same manner that was done in North America, India, and Sri Lanka. So I would like to thank you for the support. Great support given by Emily and great example given by Al, and so let's keep working. Hope to do it well.
Great, thank you so much, Patricia. And next we have our very own Dr. Bryn Zomar. She's a postdoctoral research fellow in the HIPpy lab here at BC Children's Hospital, and she's going to give an update on the HIPpy Global Registry program.
Great. Thanks, Emily. Yeah, so the HIPpy Global Registry program is run out of BC Children's Hospital and UBC out in Vancouver, and is led by Emily Schaefer and Kishore Malpuri, of course. And we have a great registry program now running with 5 different registries for pediatrics run underneath this umbrella. So 3 of these are up and running right now, 2 of them very well established, and 2 we're hoping to launch within the next year, hopefully. So we have our established registries are the Global Hip Dysplasia Registry, which has been ongoing within the HIPpy lab since 2016, and follows children with hip dysplasia. We have the SLIP registry, which is following children with slipped capital femoral epiphysis, and has been ongoing since 2018. And then our POISE registry is our newest registry, which launched just last year. And it is following pediatric patients that have orthopedic implants used to look at their safety and efficacy. And so we've got a wide range of patients that will be eligible to be enrolled in that one. And then our 2 new registries that we're hoping to launch soon is our Global Ped Ortho, which is for pediatric orthopedic trauma and health outcomes, and our Rare Hip Conditions Registry, which will hope to do similar work to what we've done with GHGR and SLIP, but with rarer hip conditions. Actually, next slide, please. So with the numbers aren't there. With GHGR, we hit some milestone numbers in the past year. We're over 5,800 patients around the world with, I believe it's 47 different centers. So it's a very global effort, and we really appreciate everyone's work that helps to enroll in this study. And next one, Ashley. And then our SLIP registry also has some milestones with our global representation of, I believe it's 37 centers on all 6 continents, inhabited continents that is, and over 430 patients in that one. So just a quick update on highlights on our global registry program. And again, we really appreciate all the centers that help contribute and all the patients that have been willingly enrolled in this. So thank you all.
Great, thank you very much, Bryn. And next, we have a video submitted from Dr. Evelyn Kwong, who's an orthopedic surgeon in Hong Kong, to speak about a rare hip condition, particularly how the hip is affected in spinal muscular atrophy.
Hello, everyone. I'm Dr. Evelyn Kwong from Hong Kong, and I'd like to share with you our experience of hip instability in spinal muscular atrophy type 2 patients receiving nusinersen. Now, SMA is a condition in which, due to a genetic defect, the survival motor neuron protein is reduced, leading to early motor neuron death and permanent weakness in young babies. Depending on how many remaining copies of SMN2 genes there are, this will determine the severity of the disease. Now, traditionally, SMA1 patients, the most severe type, would die very early due to respiratory failure, whereas on the other end of the spectrum, SMA3 patients could remain standing and walking well into adulthood. It was the SMA2 patients that presented most to orthopedic surgeons because, like this little girl, would get severe neuromuscular scoliosis and hip instability. They would often require a long spinal fusion to remain the respiratory function and the sitting posture of the patient. And the hips often came out, but we never reduced them surgically because they were not walkers anyway. Now, nusinersen splices itself into the SMN2 gene and tricks it into producing more SMN protein. And we found that even with SMA1 patients, if you could start this drug early enough, before there was any weakness, so before any of the motor neurons could die, they could reach near normal motor milestones. And this seemed to be promising for SMA2 patients as well. So in Hong Kong, we started giving nusinersen to all SMA patients by 2018. And we as orthopedic surgeons wondered, will this new drug prevent the orthopedic problems that we saw in the past? We compared 30 hips in patients with SMA2 specifically to those patients who have nusinersen now, which is 20 hips in total. And the key of this slide here is that we started nusinersen in patients in SMA2 who were at an average of 6 years and 9 months old, so well after they had some motor neuron death already. Historically, those who never received nusinersen, as expected, never could walk independently, and most were wheelchair bound by adulthood. Whereas those treated with nusinersen, even in the short few years that we gave them, they actually, most of them had improved gait or even a static gait, and only a few had a worsening gait due to other problems like severe scoliosis. For those patients who never received nusinersen, historically, actually most of their hips never dislocated, probably because they spent most of their times in wheelchairs anyway. Whereas those who were treated with nusinersen, actually all but one hip was subluxed or dislocated, just in the 3 short years that we've given it. The Reimer's index is a measure of how much the femoral head is outside the acetabulum. So the higher your Reimer's index, the more it's subluxed. And you see that all of our patients had increasing Reimer's index with time. Only one patient had one hip that had an improving Reimer's index with time. And that's only because the pelvis was so oblique that the contralateral side was abducted all the time. So what we're finding is this: SMA2 patients who now being treated with nusinersen can even play basketball, but the hips are actually slowly subluxing. And it might be due to the fact that they're standing and walking more, and that the nusinersen, if started after the onset of muscle weakness, still doesn't fully correct the muscle weakness that these kids have. So we have a patient population now treated with nusinersen that can stand and can walk. They're even community ambulators. And so the requirements for their hip position is actually much higher. And how aggressively do we need to treat these in the future? Because we all know that things like osteotomies don't always go according to plan. And we're trying newer methods like this, guided growth, and we'll keep you posted on how we're doing with that. So what we're finding is if you're only starting nusinersen after the onset of muscle weakness in SMA2 patients specifically, they still have an improvement in their ambulation, but the hip still tends to sublux with time due to persistent muscle weakness due to the previous motor neuron death. And actually, it was based on this information that we convinced the government to start universal newborn screening for all liveborns for SMA, which will start by the end of the year. Thank you for having me.
Thank you very much to Dr. Kwong for sending that video in to teach us about SMA and the hip. So now we have another of our Hip Hope Network pillar leads, Dr. Paulo Castaneda, to give an update on the International Hip Dysplasia Institute.
Morning, good afternoon, or good evening, depending on where you are in the world. My name is Paulo Castaneda, and I am the Medical Director for the International Hip Dysplasia Institute. I'd like to thank you for joining us today, and thank you for the opportunity to speak during the Hip Health Awareness Day. It has truly been a pleasure partnering with and working with our colleagues from around the world in this important endeavor. It was in 2008 that the leadership of Dr. Chad Price allowed the inception of the International Hip Dysplasia Institute, a worldwide collaboration of physicians and other healthcare providers trying to develop better outcomes for patients with hip dysplasia. Dr. Price has fearlessly led the IHDI for the last 15 years and has taken it to heights which were inconceivable in its inception back in 2008. He has recently decided to step aside to pursue other endeavors that he has charged me with the great responsibility of taking over the medical leadership of the International Hip Dysplasia Institute. We remain committed to the three basic goals that the organization established 15 years ago. These are to improve research, patient advocacy, and education, support for cutting-edge research in different areas, specifically partnering with engineering researchers who may have a similar mission. We also have a continued education effort, and for this we have partnered with multiple different professional societies, including the American Academy of Pediatrics, the Paediatric Orthopaedic Society of North America, the European Pediatric Orthopaedic Society, the Sociedad Latinoamericana de Ortopedia y Traumatología Infantil, SLEOTI, and CCOT, the International Society for Surgery in Orthopedics and Traumatology. We look forward to partnering with other societies and organizations to continue to build on clear pathways for treating hip dysplasia. The burden of hip dysplasia can only be alleviated through collaboration and knowledge sharing. The IHDI remains truly committed to this objective, to ultimately improve the lives of children and their families affected by hip dysplasia. We very much look forward to continued collaboration. Thank you.
Wonderful. Thank you so much, Pablo. Great to hear from you. And as we transition to our next speaker, I just like to give an acknowledgement. I see we have a previous hip legend on the call with us, and Ms. Deborah Eastwood, who's the current president of the British Orthopaedic Association. So thank you so much for joining, Deborah, and bringing your presence today as well. And with that, I'd also like to introduce another 2022 HIP Legend recipient to give the next talk, Dr. Nancy Muir from the Miles for Hips organization. Thank you so much for joining us today, Nancy.
Good morning. Thank you for having us. And I will say, Lauren Scholler, one of our board members, was supposed to present today, and she had something come up last minute. So you guys are stuck with me. So hopefully I can pull this off smoothly. But So we can start on the next slide. Miles for Hips is a patient-driven collaborative initiative between individuals affected by hip dysplasia in the International Hip Dysplasia Institute. Next slide, please. We believe that all patients with hip dysplasia are entitled to accurate and timely diagnosis and treatment, and that patients and families should be valued members of their healthcare team. We believe in participatory medicine and that care and outcomes will be optimized when patients and medical teams work together. Next slide, please. There are several ways we are working to enhance hip health. First, we promote patient and family education and empowerment by sharing accurate, unbiased, patient-friendly information and resources. We support hip dysplasia advocacy and awareness through our website, social media platforms, and our annual virtual and in-person community events. We believe in the mission and vision of the IHDI and fundraise to support these. We are fueled by the concept of participatory medicine. We aim to build community and collaboration between patients and families, as well as researchers, advocates, and healthcare providers, in order to encourage hip dysplasia awareness and advocacy from all stakeholder perspectives. Next slide. We invite all community members to get involved. We honor the healing and community building aspects of storytelling, and we invite patients, family, friends, healthcare providers, researchers, and advocates to share their hip dysplasia stories. We recognize the often life-changing impact that a hip dysplasia diagnosis has on patients and families, and how many want to give back to this community and use their personal experiences to impact change. We provide support for individuals, families, or small groups who want to become hip dysplasia champions and who want to raise awareness and support the IHDI through projects or fundraisers. Finally, we invite everyone from all over the world to participate in our 5th annual Day of Movement, which will be on October 14th this year. This is a worldwide event where people can get out to raise hip dysplasia awareness, build community, and support the IHDI. Next slide. We welcome healthcare providers and other individuals with research, critical appraisal, or knowledge translation backgrounds to contribute to our developing library of patient and non-expert friendly education and information resources. We also welcome health providers to let us know about questions and patient and family needs that come up routinely in your clinics and that we might be able to help address and meet. Next slide. As our calls to action, we encourage everyone to recognize, respect, and take advantage of the individual and collective expertise of all members of the HIP community, including patients and families. We also call everyone to value information exchange around the needs and priorities of all members of the HIP community in order to identify opportunities for development, collaboration, and coordination. Next slide. Make sure to check out our website and our social media platforms for additional information. Please feel free to share with patients, families, healthcare providers, and other members of the HIP community, and reach out to us if you would like to learn more or get involved. Thank you.
Wonderful. Thank you so much, Nancy. And thank you for stepping in to present last minute.
Happy to.
So next up, we have Candelaria Mercado, who is the research coordinator for the International Perthes Study Group, to give an update on their group's work.
Is a multi-center international research study group with the primary goal of determining the best way to treat patients with Perthes. The IPSG was established in 2012 by a group of specialists and researchers with the common goal of advancing knowledge and care of patients with Perthes disease. Dr. Harry Kim in the middle of the photograph is the study group chair. As mentioned, the IPSG is an international multi-center study group with 49 active surgeon members and 9 scientific members from across 16 countries coming together to better understand Perthes disease. Currently, membership is open to qualified institutions who primarily treat Perthes non-operatively. Scottish Rite for Children, TSRH, is the lead site. The executive and steering committees meet once a month to review study group goals and progress. The IPSG also hosts an annual meeting open to all members and coordinators. The study design is a prospective review of patients who present with Perthes disease in early stage, late stage, less than 6 years of age, and older than 11. The study group aims to determine treatment outcomes for patients presenting during early stage grouped by age groups 6 to 8, 8 to 11, older than 11. It also aims to determine the role of perfusion MRI as a prognosticator of outcome. Outcomes for patients presenting during late stage of the disease are grouped age 6 to 11. Finally, 2 registries have been established to collect clinic and radiographic data for patients who present younger than 6 years and older than 11. Over the last decade, over 850 HIPs have been enrolled into the study from all around the globe. 13 publications have come out of the study group, and it has been awarded 4 POSMA grants to date. As the lead site, TSRH performs a thorough audit of all the data being collected to ensure data quality. All participating sites collect clinical radiographic, perfusion MRI, and PRO data. Promise measures are being collected at some of the participating sites as well. This year, the IPSG was able to present the initial findings at 2 years for the 8 to 11 non-weight bearing post-femoral varus osteotomy cohort at both EPOS and POSMA, among other studies. Another notable presentation was how are adults with Perthes disease functioning after a total hip replacement, results of an international web-based survey. 3 publications have come out of this survey, which had over 1,100 respondents. Engagement with Perthes support groups is another focus of the study group to help bring more awareness and knowledge of the disease. Dr. Harry Kim represented the IPSG at the most recent Perthes camp organized by the Perthes Kids Foundation.
Okay, great. Thank you very much, Candelaria. And next we have Joel Sloan, who's Managing Director of the HIPpy Lab at BC Children's Hospital, to give an update on the HIPHOPE network. Take it away, Joel.
Thanks, Emily. Happy Hip Health Day, everybody, from Vancouver. The HIPHOPE network is an inclusive community of all types of hip health professionals around the world. Our vision is to have a solution for every hip health challenge, and we aim to realize that through building a connected community of hip health practitioners, supporting research and knowledge translation, providing professional development and education opportunities, and through growth and outreach initiatives such as establishing Hip Health Day and hosting these special gatherings of key hip health advocates from around the world. Recently, we held our second annual all members meeting with people joining us in person in Nashville, Tennessee, as well as online from around the world. And we had a chance to go over a number of developments that I'm happy to briefly touch on now. Next slide, please. The many various updates generally fall under themes of growth, engagement, and content development. I'll mention a few highlights. As we're still a relatively new group, we're actively introducing a number of initial content areas with respect to research and education. We've also engaged with a partner to actively moderate clinical discussion and related live online events. And we're engaging researchers on the new Rare Hip Condition Registry and all types of hip health professionals with a new mentorship connection program. So there's lots happening, and this is just the beginning. At this time, we're also organizing action committees to help join the amazing volunteers that have been leading the program areas to help drive and build out all the new and upcoming initiatives. There are lots of opportunities to get involved. Visit hiphopnetwork.org, and I believe the Hip Hope Network contact info will follow at the end of this presentation. So please do stay connected and share with your colleagues. There's lots going on, and we're very excited about what's next. Thanks very much, and happy Hip Day again, everybody.
Okay, thank you so much, Joel. And finally, in this section of the presentation, we have Regina Wilkin, who's the Executive Director for the I'm a HIPpy Foundation.
Good morning. My name is Regina Wilkin, and I'm the Executive Director of I'm a HIPpy here in Vancouver, Canada. I'm really sorry I'm not able to join you in person this year, but as always, it is a privilege to be a part of the celebration of International Hip Health Day, especially in honor of our hip legends this year. As most of you know, we proudly support the important work that Kishore, Emily, and the incredible team at the HIPpy Lab do in their efforts to improve hip health, mobility, and quality of life for children here in BC and globally. We at I'm a HIPpy are passionate about children's hip health and recognize the importance of early detection and diagnosis. We are committed to creating platforms that will inform and educate, that will support research and innovation, so we can help reduce the burden of a hip disorder diagnosis. In line with this, and in celebration of International Hip Health Day, we are excited to announce our biggest public service educational campaign to date. Starting June 1st, we will be rolling out an initiative that will ensure that every family that delivers in BC is equipped with information that will help them care for their baby's hip health and set their child up for a hip healthy, active, and pain-free life. So every new family that delivers will receive a Be Hip Health Aware gift package with some friendly reminders from our own Hopper the Frog. They will have access to important information such as DDH, risk factors and symptoms, safe swaddling practices, as well as information on other hip disorders. Our hope is that over time, this campaign will help reduce the incidence of late presenting hip dysplasia. And finally, we have a couple of events coming up towards the end of June. On June 23rd, I believe it is, we have our 3rd annual Hopper Cup golf event. Please, if you're in the area, if you're in Vancouver, think about joining us. It's a really fun day out, and there's a awarding ceremony and a full buffet dinner at the end of the day. So if you're interested, again, we will put the registration details on the chat box. I hope you'll come and join us. And of course, our biggest fundraiser event of the year is our fundraiser gala, which is coming up in October. This is on October 7th at the Westin Bayshore Hotel. As always, you know, we put on a good show. It's a lot of fun, and it's a really great way to show our support. So if you're in Vancouver, or if you want to come to Vancouver for this event, again, please let us know. We would be more than happy to have you. So on that note, I just wanted to once again say congratulations to our HIP legends for this year. Thank you for all that you do. And of course, just a quick thank you as well to the team at Hip Hope Network for putting on another good event this year. Thank you for having us as always. Congratulations on the success of the 3rd International Hip Health Day. Thank you very much and have a good weekend.
Wonderful. Thank you so much, Regina. So now we're going to be moving into the next section of our agenda. So thank you all to the groups that presented today. That was an amazing roundup of hip health highlights from around the world. So that was so very appreciated, and we wish you all continued success. And I particularly look forward to many future collaborations. I can't wait to see what you'll all accomplish on the mission for hip health globally. So moving on, I am so excited to present the 2023 HIP Legends Award. So for the 3rd year, after receiving nominations from around the world, we're recognizing a number of HIP legends who have made long made outstanding accomplishments in various aspects of improving hip health. So a HIP legend is a person or a group who has made significant contributions to the hip health community. So it's an honor to help recognize these 5 individuals for their exceptional achievements, their inspirations for us all. And so before I call on nominators to introduce and then hear from each HIP Legend Award recipient, please let me express my heartfelt congratulations and well done to all of you. So our first 2023 HIP Legend, Laura Rutterford, will be introduced by past HIP legend, Nancy Muir, a HIP legend in 2022. So please take it away, Nancy.
Great. I'm very excited to be here today, and I am absolutely thrilled to introduce Laura Rutterford as one of the 2023 HIP legends. Laura is a UK-based physiotherapist who has used her personal journey with hip dysplasia to inspire her professional development, as well as her advocacy and her awareness work. Laura has been a physiotherapist for over 10 years and has devoted a substantial part of her career to becoming an expert in the physiotherapy management of adult patients with hip dysplasia. Laura has developed her practice to support patients virtually so that individuals with hip dysplasia can benefit from her specialty services from all over the world. In addition to her physiotherapy degree, she is also a Pilates instructor. Laura is always a strong proponent of movement for health and wellness, and she uses her expertise to develop individualized and online Pilates-based programs for individuals with hip dysplasia. Laura has partnered with us at Miles for Hip several times. She has volunteered her time and expertise by hosting free virtual Pilates sessions to celebrate movement for individuals. She honors the unique journeys and strengths of all participants and has an incredible ability to meet people wherever they are at in their hip dysplasia journeys. This allows people to experience the joy of movement, no matter their physical status. Laura also hosts the website Help for Hip Dysplasia. This platform allows her to share her professional work and allows individuals with complex hip conditions to contact her from all over the world. She also hosts the Help for Hip Dysplasia podcast and is currently in her 4th season. Through this project, she has interviewed a wide variety of individuals, including patients, medical providers, researchers, and advocates. Her interviews are professional, informative, rich, inviting, and thoughtful. Laura is a true lived example of a HIP legend. She is a determined, passionate, and generous woman. Laura has fought to overcome great challenges in her own life related to hip dysplasia, but she boldly, courageously, and selflessly has embraced these challenges and has channeled them into wonderful opportunities to serve others and to truly provide help for hip dysplasia. Thank you.
Thank you very much, Nancy. And Laura, we're happy to hear from you. Congratulations.
Hello, everybody. Can you hear me?
Yes.
Thank you, Nancy, so much for that introduction. That was absolutely overwhelming, and it's so amazing to have had you do that when we've worked so well together and so much together in the past. Thank you so much for that. So yeah, hi, I'm Laura, and it is such an honor to be amongst so many incredible and influential people in the world of hip health. Thank you for naming me a hip legend. It means so much. I definitely had to read the email through like 5 or 6 times before I thought it was real, and then I cried. So it's all been very emotional, and yeah, very honored. Raising awareness of hip health, and in particular hip dysplasia, is the reason that I'm here. I feel like it's my purpose. I feel privileged to have had the diagnosis of hip dysplasia because it led me into a career that I love as a physiotherapist. And it gave me a chance to be able to speak to people about hip dysplasia from both a personal and professional perspective. Raising awareness is an important part of the fight to get every baby scanned, to achieve an early diagnosis and prevent unnecessary surgeries, pain, and restrictions later on in life. By raising awareness, we can also empower parents to advocate for their children to be scanned. We can provide community for those who have felt alone. We can provide support and strategies to help those that are currently in their journey. And we can provide hope and inspiration from those who have already found their way through. Sometimes you don't always know who's listening to the things that you have to say, especially on social media. So being given this award really was such a surprise, and it means so much. That there is value in information, empowerment, community, and support. And this gives me even more drive to continue to spread those messages. So thank you so much.
Wonderful. Thank you so much, Laura, and congratulations on a truly well-deserved Hip Legend Award. So next we have Dr. Jason Howard has submitted a video to introduce our second 2023 Hip Legend, Dr. Kerr Graham.
Hello, it's my honor to introduce Professor Kerr Graham as this year's nominee for Hip Legend for the 3rd Annual Hip Health Day. I was brought under Professor Graham's wing as a fellow at the Royal Children's Hospital in Melbourne, Australia, back in 2003, almost 20 years ago. Although I didn't realize it at the time, my meeting and mentorship under Professor Graham was going to shape my career for the rest of my life, as it had so many others before and after me. Globally known as a thought leader in the world of CP, Professor Graham was instrumental in identifying the true prevalence of hip displacement in CP through a large population-based cohort from the Cerebral Palsy Registry in Victoria, Australia, which for the first time linked the prevalence of hip displacement to GMFCS level. Through this seminal publication, a framework for the development of the Australian Hip Surveillance Guidelines was developed, becoming the global standard by which other surveillance programs have subsequently been based. This paper also introduced the ubiquitous cartoon GMFCS drawings that Professor Graham designed with Bill Reed, known now around the world. These were historical times, and I was so fortunate to be a part of it. Professor Graham is a staunch advocate for evidence-based medicine. In the world of hip displacement, he thoroughly investigated the role of adductor spasticity in the development and treatment of the hip and CP. His randomized controlled trial of botulinum toxin injections, which reduced adductor spasticity, showed unequivocally that this treatment did not prevent the need for hip reconstruction. A subsequent paper investigating the results of adductor surgery for hip displacement showed that the survivorship of this soft tissue procedure was linked to GMFCS level, with non-ambulatory children being at high risk of hip reconstruction despite this early soft tissue surgery. These and other insights have helped develop and help change our thinking about the prevention and treatment of hip displacement in cerebral palsy, highlighting that features other than spasticity are likely causative. Professor Graham believed long-term outcomes and validated outcome measures were important and essential to investigate prognosis and treatment. His 2016 paper on hip health at skeletal maturity, published in Developmental Medicine and Child Neurology, helped us to understand what happens to these hips over time, identifying hip pain in over 75% and improved outcomes for those with early hip surveillance and access to orthopedic surgery. These findings further solidified the need for early diagnosis and prompt treatment to get the best long-term outcomes for our kids. Ever inquisitive and constantly searching for answer, Kerr continues to investigate issues relating to the betterment of children with CP as a whole, and not only at the hip. His patients and families adore him, and they miss him now in retirement. I consider myself lucky to have trained with this hip legend, one who continues to mentor me throughout my orthopedic career. He's an inspiration in our field, ever highlighting the need to continually ask questions that matter and not to stop until you find the best answers for your patients. I thank you very much, and I hope you have a great day.
Wonderful. Thank you very much, Dr. Howard and Dr. Graham. Take it away. Congratulations.
Thank you so much. It's a great privilege to be linked to Hip Hope and to be nominated and to receive this award. I'm really very honored. I'm overcome, and I'm delighted to be part of this meeting. It was wonderful just now to hear Jason and to see a number of previous fellows from Melbourne participating in the meeting today. It's almost 3:45 in the morning, and the weekend is over in Melbourne, and it's just so great to hear you and see you all. Just like Laura, I've had some personal experience of hip dysplasia, and I think that colored my entire professional career. I was a late diagnosis of DDH long before clinical screening was widely applied. So I had closed reduction, I had avascular necrosis, I had years of pain, I've had arthroplasty and revision arthroplasty. So when I met families with children with any hip disorder, from Perthes to DDH, and particularly in cerebral palsy, because so many of those children can't speak eloquently for themselves, I had a particular feeling that their voices needed to be heard, and we needed to maximize our efforts to identify risk factors, diagnose early, and offer early effective treatments. And we've tried to do that over many years, but it is now time to pass on the torch, and I am absolutely thrilled and delighted with the talent and the enthusiasm that's expressed in this meeting. From the team in BC to all around the world, people are working collaboratively, sharing data, and I believe the future for many pediatric hip disorders is going to be so much better than what perhaps Laura and I went through in our childhoods and in our experience. So thank you all very much indeed. I'm greatly honored.
Congratulations on a truly well-deserved honor, and thank you so much for joining us at such an early time for you today as well. So moving to our third hip legend, Dr. Reinhard Graf will be introduced by Dr. Sally Scott. So please take it away, Dr. Scott.
I am delighted and honored to be asked to introduce Professor Reinhard Graf to the Hip Health meeting. Reinhard Graf qualified as a doctor from the University of Graz in Austria in 1971, Graz also being the city of his birth. After qualifying first as a general practitioner in 1980, Reinhard Graf started his career in orthopedic surgery. In the absence of any voluntary volunteers, Reinhard was soon volunteered by his professor of orthopedics to look at the possibility of using ultrasound in the locomotor system. His first paper showing that the infant hip could be seen on ultrasound was published that same year in 1980. With extensive further research, Reinhard Graf developed a reproducible, systematic, age-related method of hip ultrasound that enabled early diagnosis of hip dysplasia and facilitated early treatment that can be monitored by ultrasound. Hard-won recognition of the value of his work has led to the introduction of universal hip screening by 6 weeks of age using the Graf method of ultrasound in a number of countries. Firstly, Austria in 1992 and in Germany in 1996. The results show that early diagnosis and treatment monitored by ultrasound enables early conservative treatment with an extremely low rate of open reductions, thus giving better results in less time with fewer complications. Safer, shorter, simpler treatment with an 80% reduction in the incidence of first operation for DDH. From 1988 to 2011, Reinhard Graf was also the medical director of the General and Orthopaedic Hospital Stolzalpe, Austria. He was appointed Professor of Orthopaedics to the University of Graz in 1990. He is an elected member of the German Academy of Sciences, Leopoldina, which is the oldest continually surviving academy of natural sciences and medicine in the world. He is past president of the Austrian Society of Orthopaedic Surgery and of the International Society of Ultrasound of the Locomotor System. In addition, Professor Graf is an honorary member of 22 societies internationally, including the European Hip Society and POSNA, Paediatric Orthopaedic Society of North America. Co-author or author of 250 scientific papers, he is also the author of 4 books. His book, Baby Hip Sonography, is now in its 7th edition. He is the co-author of a further 15 books. Professor Reinhard Graf is a brilliant and humorous teacher, and he has given over 500 training courses in all the European countries, Canada, Australia, China, Russia, Mongolia, South Africa, India, and Turkey, among many others. As well as being an inspirational teacher, he is an outstanding clinician, researcher, and mentor who has had a major impact on hip health, a true hip legend. Thank you.
Thank you very much, Dr. Scott, and huge congratulations, Dr. Graf. Let's take it away.
Ladies and gentlemen, I would like to thank you and especially Sally Scott for her nice words. I'm really astonished, and I only can thank all the colleagues in the different countries who started also with hip sonography. The problem of hip sonography is that it seems so easy to handle, but generally, when I look back to the history, I would like to say it is not necessary to make the same mistakes we did 30 years ago. It is only allowed in our countries to do hip sonography when you have a special certificate after a training course. The training course must be done by certificate trainers. To be a professor is not enough. Yeah, and on the other side, it is very amazing, and we started 25 years ago to train colleagues in the different countries that they train their own colleagues. And the outcome is that when they invited me, there is no need to invite me. They only want to demonstrate Graf is still alive. Yeah, and it is really wondering sometimes. Yeah, when we discuss the screening, first we have to look what technique. The other techniques in our countries are strictly forbidden because they lead sometimes to overdiagnosis or to misdiagnosis. That easy. And the screening, also a bad joke. In one night, Shakespeare came down to the chimney as a ghost and told me the following: to screen or not to screen is not the question, it is politics. It depends from the common health system in the different countries. We have also a problem, a big problem now in our countries. You will not believe. We have too few cases to operate. We have orthopedic surgeons, pediatric orthopedic surgeons that never had seen an open reduction. Because of our screening, we closed also some departments for pediatric orthopedics. No hip joints to operate. This is the problem now. But on the other side, one mother asked me, why you do this examination? And I explained the girls or the kids are limping. She said, I cannot believe this disease is not existing anymore in our country. That is it, what we should do. No limping girls or young gentlemen. No need for it. I thank all the colleagues who do hip sonography in the correct way. And I thank you, especially Sally Scott. I thank you because you are always watching me. And I'm sorry, even when you tried, my English had not improved. Thank you so much.
Thank you very much, Prof. Graf. Congratulations. It's truly an honor to hear from you today and to be in your presence. So thank you. All right. Moving to our fourth HIP legend, I'm delighted to get to introduce 2023 HIP legend, Caden Teneycke. He has provided an acceptance video as he is traveling today. But although just 18 years old, Caden has long been a powerful and effective advocate for hip health for years. Caden has a rare form of dwarfism called spondyloepiphyseal dysplasia congenita. At the age of 11, he began curating content and garnering social media followers. So he has used his impressive platform, which now numbers over 650,000 followers on TikTok and counting. I'm sure that number is even higher since I looked this up, to document his journey and experiences and to raise awareness for hip conditions in children. He's been a tireless HIPpy ambassador for the I'm a HIPpy Foundation and has co-hosted the annual I'm a HIPpy Gala each year. And this gala, as you've heard from Regina Wilkin earlier, serves as the primary fundraiser to support global efforts in hip health for the HIPpy Lab, including the Global Hip Dysplasia Registry. So his work in advocacy using his global platform, Caden has made indelible impacts on advancing hip health awareness and education for children and their families worldwide. So thank you, Caden, for your tireless advocacy. And give him a follow on TikTok, Instagram, or YouTube to check out some of his fantastic content. So huge congratulations, Caden.
What's up, everybody? My name is Caden Teneycke. As an ambassador for the I'm a HIPpy Foundation, it is an honor to be recognized as a hip health hero by the Hip Hope Network. Now, my journey with hip dysplasia started from birth. In relation to my condition of spondyloepiphyseal dysplasia, I have been dealing with hip dysplasia my entire life. Without the fantastic care by Dr. Kishore Malpuri and his team at BC Children's Hospital, I would not be where I am today. And I am extremely thankful for everything that him and his team has done to help me maintain my mobility. I am extremely proud to be a part of the I'm a HIPpy Foundation and help provide awareness as well as raising funds for additional hip health screening efforts. And I regret so much not being able to be here today in person, but I would just want to express my gratitude for this award and say thank you.
Wonderful. Congratulations, Caden, and thank you for all of your work. And so moving to our fifth HIP legend, Dr. Vrisha Madhuri will be introduced by Dr. Deeptiman James.
Pleasure to introduce our 2023 HIP legend, Professor Vrisha Madhuri from Christian Medical College, Bangalore, India. Professor Madhuri is an accomplished clinician, scientist, a visionary, and an excellent academician. Professor Madhuri, an alumnus of CMC Bangalore and the Liverpool University, was the president of the Paediatric Orthopaedics Society of India from 2014 to 2017, and headed the Pediatric Orthopaedics Department at CMC Bangalore for over a decade. She is the current Ida Scudder Chair for Clinical Research at CMC Bangalore, an elected member of the International Pediatric Orthopaedic Think Tank, and member of several orthopedic societies, and the Director at Large for the Global Initiative for Children's Surgery. Professor Madhuri is widely published, has several patents, and conducted numerous research projects that have transformed pediatric orthopedics in India and elsewhere. She is a familiar face in several pediatric orthopedic meetings and conferences in India and abroad. She has given several talks and orations on children's musculoskeletal disorders in multiple national as well as international forums. She established a 2-year postdoctoral clinical fellowship in pediatric orthopedics at CMC Bangalore from 2008 onwards, and has trained multiple national and international fellows, as well as PhD, postgraduate, and undergraduate students. As a clinician scientist, our aim is to translate basic science research into clinical practice. She has multiple ongoing projects, including the BOOST 2B clinical trial in osteogenesis imperfecta, the autologous chondrocyte transplant for visceral defects, and muscle-derived stem cell therapy in critical regeneration. Her pioneering work in idiopathic chondrolysis of HIP and its staging, based on the extent and the duration of symptoms, highlighted the correlation between findings at surgical dislocation and the final clinical outcomes. She has written chapters on tuberculosis and other infectious pathologies of the hip joint. The credit for one of the largest ultrasound hip screening for DDH in an Indian cohort goes to Professor Madhuri. After conducting an initial screening of 1,000 neonates, she worked in collaboration with the Indian Council of Medical Research to screen over 15,000 neonates, which found a high incidence of 2C hips, which were diagnosed with ultrasound screening. Professor Madhuri trained with Professor Millis and is one of the first surgeons in India to do surgical hip dislocations, hip reconstructions, and periosteal osteogenesis. She has been an excellent mentor to scores of pediatric orthopods, residents, students, as well as scientists, researchers, and her colleagues. It is a matter of great pride for me as Professor Madhuri's former student and current colleague to introduce her as the 2023 HIP legend. Thank you.
Good morning. It's my great honor to accept the HIP Legend Award on HIP Health Day celebration events at my home. Thank you very much. I'm in very good company with legends like Professor Weinstein and with Professor Millis. Having been previous awardees, really happy to receive the award. Thank you.
Wonderful. Thank you so much, Dr. James, and congratulations, Dr. Madhuri. And Congratulations and thank you to all who helped with those kind introductions and nominations. And huge congratulations again to our newest class, 2023 HIP Legends. All your efforts and achievements are an inspiration to us all. So thank you so much for everything that you do. And to those of you joining us today in person, thank you so much as well. So with that, at this time, I'd like to acknowledge and thank the kind and generous support that enables the Hip Hope Network, especially from two key funders, the Peterson Group and I'm a HIPpy Foundation. We're humbled and honored by all of your incredible support, and what we're able to do on Hip Health Day and throughout the year is directly thanks to you. So please accept our deepest appreciation. And in the continued spirit of gratitude and to help raise awareness of hip health, some of you may have seen this in the lead up to Hip Health Day on social media, but please join us on social media by celebrating your hip squads. So we all rely on support of others in our hip health efforts, whatever role we have. Your hip squad is the community that has supported you in your personal or professional hip health efforts. If you're active on social media, we encourage you to acknowledge your hip squad there and be sure to use the hashtags Hip Health Day and Hip Squad. Okay, and so now we'd also just like to pause the presentation at this time and ask all who are willing and able to turn on your cameras for a brief moment so we can capture a few images of your smiling faces for posterity and for our event materials. All right. Thank you so much, everyone. Tomorrow, let us know when we're good to go. We're Ryan.
Ryan, are you able to take the shot? My app keeps freezing.
Yeah, for sure.
Thank you.
Okay, smiles on 1, 2, 3. And we got multiple pages here, so just bear with me. Smiles on 1, 2, 3. Perfect.
Wonderful. All set?
Yeah.
Okay, thank you. All right, so if you can, thank you, Ashley. Put the slides back up. So do please stay in touch with us at the Hip Hope Network. You can connect with us in several ways. Stay in the loop as we add materials and announce events, and the recording of this event will also be posted on our website shortly too, and you can access previous years of Hip Health Celebration recordings as well. And so before I just pass it over to Kishore to give a final concluding remark and a thank you, I just want to say huge thanks again to all of our presenters and HIP legends, and a very big thank you to everyone who joined us from around the world. And I would really like to call out a few HIPpy Lab team members who have been working furiously in the background to make this event a success. Tamara Dudley, Ryan Hawking, and Joel Sloan for really pulling this event together. So thank you, you guys. The event is successful because of you today. And happy Hip Health Day, everybody. And Kishore, I'll hand it over to you.
Great, great. Thank you all for joining us. It's a real honor for me to be here sharing this day with all of you. This is just the beginning, I think, in our hip health journey. As Laura rightly put it, we all have a different reason why we got involved. We heard from Professor Graham. I worked with him. I did not know this story. You're always learning something about why somebody got involved, something like that. And you know, I've not worked with everyone. There are some I work closely with, some you watch their work, you read their work. Professor Graf, it is true that you know, everybody thinks you're a lot older than you are, and it's great to actually see you on the screen. I've never had the privilege of shaking hands with you, but I happened to be in your country some time ago. If only I knew, I would have been at your doorstep knocking on your door. But next time I come to Austria, I will do that. I'll surprise you with a visit to your home. It's a real privilege with all of these people, whether it's Deborah Eastwood, who was a previous HIP legend, or Alric with the amazing amount of work he's doing, Nancy, and what the whole importance of doing this is to bring everybody together, to celebrate the amazing work, but also to remind ourselves lots done, a lot more to do. And certainly I've been kind of put on this journey by people like Kerr that inspired me to be an academic clinician, inspired me to be curious about what's going on and always ask tough questions and never take an easy route to answer, but probably increase the rigor in everything you do. So, and he's got several of his fellows here, and I bet several of people that have been inspired by people like Dr. Graf and Ms. Eastwood and Nancy and everybody else that are here. You've all contributed in very many different ways. This Hip Hope Network is going to be the future of hip health of children. And the reason that even though, as you've heard, our biggest support, and I would say 98% of our funding comes from these two organizations that you've heard. And Peterson Family has been an incredible pioneer in supporting us. I'm a HIPpy, which is a Vancouver-led grassroots organization, said, we want to be relevant to every single child that's born around the world. And little did we know, 6 years ago, when they came and said, we want to support you, we would be where we are today. And truly, we go with the concept of local to global. And that's what we want you to do, whether it's Patricia, who is working in Brazil, trying to improve care in Brazil, or we've got folks today joining from Turkey, India, Australia, Austria, and wherever. We want you to do everything you do locally to improve the hip health. But we humbly think together we can improve globally. If imagine the power that you can have from your 200, 300,000 to 2 million, 3 million to your countries of 18, 30 million to truly having a global impact with 6, 7 billion people. And we truly believe we can do that. We think that some of the efforts that we do will continue to improve the hip health of children everywhere. So we will have a third in-person meeting on the sidelines of POSNA and ePOSNA of the Hip Hope Network. So stay tuned for that. We hope you can join, and we're looking forward from that meeting to take another step where we will be starting some really important discussions about way forward for improving hip health. And those of you like Professor Graham and who's stepping aside from active clinical practice, Kerr, we're counting on people like you, Ben, and others around the world to continue to educate people and continue to inspire others. If you've got still some energy left in you, we're counting on you for this network to move forward. And we appreciate people like Nancy, who's tireless, and those people are not done when their children's journey are done, but really want to help other people. So truly inspiring to be here. And as I always say, it's always a team effort. And we have an incredible team here in BC and around the world to finish 18 different presentations and responses with 15 minutes still left is an incredible feat. And Emily and Joel and Tamara, the three people that have taken a major lead in this with the help of everybody else on the HIPpy team and Ryan, this is to you. The reason the HIPpy Lab is what it is, the reason we're able to actually do all of this, bringing people around the world, is because of efforts like people like you. Thank you.